My name is Don Richardson, and today I'm going to talk about our research on the well-being of Canadian veterans during the COVID-19 pandemic. This type of research cannot be done alone, and I would like to thank our entire research team at the Macdonald Franklin OSI Research Center, our collaborators, and our veteran and veteran spouse representatives. Why is this important? We know from current research on the general Canadian population that approximately 40% have reported worse mental health since the pandemic, and 20% reported increased alcohol consumption. The veteran population are an at-risk group in Canada with increased rates of mental health conditions, especially PTSD and depression, and we know that pre-existing psychological distress may be compounded with the drastic life changes caused by the pandemic restrictions. The primary objective of this study was to capture the impact of the COVID-19 pandemic on the well-being of veterans and examine the veterans' acceptability and perception of changes in healthcare delivery resulting from this pandemic. The study design is that it is a prospective longitudinal online study, and baseline data collection was done from July 2020 to February 1st, 2021, and it includes follow-ups every 3 months for 18 months. It was open to all Canadian veterans and spouses of Canadian veterans, and recruitment was done through professional networks, press release and media events, veteran communities and advocacy group, and social media. In terms of methodology, there are questions specific for demographics and work-related questions. In terms of mental health conditions, we use the PCL5 to assess for PTSD, the PHQ-9 to assess for depression and suicidal ideations, the GAD-7 to assess generalized anxiety disorder, and the audit for alcohol use disorder. We use the adapted crisis scale specifically for COVID-related fears, COVID-related exposure, worry, and life changes due to the pandemic, and then specific questions with regards to healthcare access. In terms of baseline results, we had a sample size of 1,176 veterans with a mean age of 55.4. The majority were male and white, and approximately 80% had served in the Canadian Forces. 73.1 were married or common law, and there was an equal spread among large cities, small cities, and rural areas. And most were living with their spouse, and only 16.7% were living alone, and there was a good representation across provinces. In terms of mental health conditions, 57% of veterans indicated that their mental health has worsened with the pandemic. In terms of mental health conditions, 36.7% met the cutoff criteria for probable PTSD, 38% for probable MDD, 28.9% for probable GAD, 14% for alcohol use disorder, and 24% endorsed having suicide ideations. 39 to 53% attributed their symptoms as being directly related or exacerbated by the pandemic. When examining the impact of COVID-19 exposure to mental health, being exposed to COVID-19 was significantly associated with higher depression scores, higher anxiety scores, and higher scores on PTSD, but not higher scores on alcohol use. In terms of access to care, 49% of veterans indicated that they had difficulty accessing care, and 27% reported having no difficulty. Most concerns were related to physical health or a combination of physical and mental health. Of those who were unable to access care for mental health, they were more distressed than those unable to access care for physical health. One of the dramatic changes in healthcare delivery was the transition from in-person care to virtual care. And from our study, approximately 72% of veterans indicated that they would recommend tele-psychiatry to a friend, demonstrating its acceptability in the veteran population. And approximately 73% indicated that they would prefer telehealth over in-person care even after the pandemic. Our study demonstrated that most veterans reported worsening of mental health functioning with this pandemic. A significant proportion attributed their mental health symptoms as either directly related or exacerbated by the pandemic, and mental health symptom severity, specifically depression, anxiety, and PTSD, were associated with COVID exposure. On a positive note, there was a positive response to telehealth, which has clinical implications post-pandemic. This type of study has significant limitations in that it may not be representative of all Canadian veterans, and it is cross-sectional baseline data. Thank you for your attention, and please do not hesitate to contact me if you have any questions regarding this study.